Good day, future RMTs, future MDs. So for today, we will be discussing about cartilage, bone, muscle, and nervous tissue. This is Dr. Francis Ian Salaver, and I will be your lecturer. Cartilage is a tissue, and tissues are made up of cells and extracellular matrix. So expect that you will find these components in a cartilage. The cells of the cartilage are called chondrocytes. And these chondrocytes are found embedded within the extracellular matrix of the cartilage, which is made up of fibers and ground substance. The cells of the cartilage are called chondrocytes. So these are the cells that you can find in the picture. And take note, the space that they occupy within the cartilage is called a lacuna, singular, lacunae, plural. These chondrocytes function to produce the fibers and ground substance of the extracellular matrix of the cartilage. Before I will discuss the components of the extracellular matrix of cartilages, I want everybody to be reviewed from our discussion on connective tissue that the fiber that will predominate in cartilages is type 2 collagen fiber. There's an important characteristic of collagen type 2 that I want you all to take note. It is highly refractile, thus it will not be visible even if you will stain the cartilage with hematoxylin and eosin. This is a picture of a cartilage. As you can see, you have here chondrocytes in their own respective lacunae. Take a look at the extracellular matrix. Can you appreciate the presence of fibers? No, right? Because the fiber that is present in this type of cartilage is collagen type 2 and it is highly refractile. Thus, it cannot be seen under the microscope even if the cartilage is stained with H&E. So what we can do at this point is assume that there are fibers in there. Extracellular matrix is composed of ground substance and fibers. What makes the ground substance of cartilage unique from the other tissues is that its ground substance is rich in chondroitin sulfate. Please recall that chondroitin sulfate is one of the glycosaminoglycans. This chondroitin sulfate is abundant in cartilages, and it is the reason why cartilages are resilient. They can withstand compression forces unlike our bones and our connective tissues. In terms of fibers, there are cartilages that have collagen type 1, there are cartilages that have collagen type 2, and there are cartilages which have both collagen and elastic fibers. And we will discuss them as we go along with the lecture. Let's go back to this picture of the cartilage. At this point, please familiarize yourselves with how chondrocytes appear so that if you're already used to how they look, it would be easy for you to identify that the tissue you're looking at is a cartilage and not a bone and not a connective tissue and not an epithelium. Then, look at the extracellular matrix. You won't see in there red-colored areas which could represent blood vessels because cartilages are avascular and aneural, meaning they don't have blood vessels and nervous tissue. By the way, the chondrocytes in the picture are occupying spaces called lacunae. An important area within the cartilage tissue that I want you all to take note is the territorial matrix. This area appears darker compared to the other portions of the cartilage. And most of the time, these are areas that we can find surrounding the lacunae of the chondrocytes. And what makes this area dark appearing is because it is basophilic. When you say basophilic, it's supposed to take up basic dye. And one of the popular basic dye is hematoxylin. So this area will appear dark blue. Now, what is the reason behind these areas would appear darker or would have dark blue color or basophilic characteristics compared to the other areas within the cartilage? It's because these areas are rich in ground substances, particularly the glycosaminoglycans. Take a look at this picture of the cartilage. Look at the chondrocytes. You know very well that they occupy spaces called lacunae, and appreciate that around their lacunae, you have their dark blue staining areas. And they are labeled in the picture as territorial matrices. So those areas are basophilic because they are rich in ground substance component. So take a look at this picture of the cartilage. Please take a look at the areas surrounding the lacunae of the chondrocytes. They are basophilic and they are named territorial matrix. The light staining areas, or the areas other than the territorial matrix, will be referred to as interterritorial matrix, meaning they are between territorial matrices. Just like what I have mentioned, what makes the ground substance of the cartilage unique is that it is rich in chondroitin sulfate, which is one of our glycosaminoglycans. And the abundance of the chondroitin sulfate enables the cartilage to withstand mechanical stress, compression forces without getting distorted. Another reason why cartilages can withstand compression forces is that their ground substance can store large amount of water. You have learned from the previous lecture that in the joints, you have their bones that are articulating against each other, and their surfaces are covered with articular cartilages. And these articular cartilages are prone to being compressed by the bones every time that they will articulate. But thanks to the ground substance of the cartilage was able to store water, so that if the cartilage will be compressed by the bone, the water will move and distribute the forces generated by the compression by the articulation of the bones. That's why one of the functions of the cartilage is to allow bones to glide on each other, because their surfaces are covered with cartilages, because cartilages can act as shock absorber. Another function of the cartilage is to provide support, especially to soft tissues. A good example I can give you is the trachea. So please refer to the picture of the trachea on the slide. Now, the trachea is a soft tissue. The wall of the trachea can easily collapse. Thanks to God, He placed C-shaped hyaline cartilage on the wall of the trachea. So expect that the anterior side and the lateral sides of the trachea are supported with cartilage. Just try to imagine, if my trachea doesn't have a hyaline cartilage as support, I might have difficulty of breathing because my trachea will suddenly collapse and I cannot breathe anymore. This is the cut section of the trachea. Please appreciate it is a soft tissue, and since it is a soft tissue, it is prone to collapsing. That's why its wall should be supported with hyaline cartilage. And what we will do now is to make a thin section of the trachea and look at it under the microscope. This is how the trachea will look like under the microscope. Take a look at its lumen. That is where the air will pass through every time we will inhale or exhale. Take a look at the structure that is labeled as cartilage. Can you appreciate that it is C-shaped? That is now the hyaline cartilage support of the trachea. And that is positioned there, placed there, to not allow the walls of the trachea to collapse. Other cartilages in the body function to provide flexibility. And a good example I can give you is the elastic cartilage present in the epiglottis. Epiglottis functions to close the airway every time we are swallowing food, so that the food will go directly to the esophagus and not into the larynx. And for the epiglottis to do that, the epiglottis must have some degree of flexibility. And that is only made possible because of the presence of the elastic cartilage in the epiglottis. Another important function of the cartilage is to provide template for bone formation. Do you know that some of the bones in the body were originally produced as cartilages during the embryonic stage? A good example of these bones is the humerus. So take a look at the development of the uterus during the embryonic stage. Can you appreciate that it started as a hyaline cartilage? This hyaline cartilage will be eventually invaded by nutrient arteries, and the nutrient arteries will carry along with it mesenchymal cells, which will give rise to the cells of the bones. That's why the cartilage will be slowly replaced by the bone. This is a good model of a cartilage. Take a look at the chondrocytes in the center. Appreciate that the chondrocytes are occupying spaces called lacunae. And then, take a look at the borders of the cartilage. You have there the presence of a dense, irregular connective tissue. Dense, irregular meaning it functions to provide protection, right? And this dense, irregular connective tissue is labeled as perichondrium. And you have perichondrium on both sides of the cartilage. Take a look at one of the perichondrium. Can you appreciate that there is that red hair-like structures embedded within the perichondrium? These red hair-like structures are representing arteries. You have learned a while ago, cartilages are avascular, meaning they don't have their own blood supply. So the question now is, where are they getting their blood supply, the nutrients and the oxygen? They are getting it from the perichondrium because you have their blood vessels. Perichondrium is the dense irregular connective tissue covering of the cartilage which has blood vessels and nerves, and it functions to provide protection and separate the cartilage from other tissues. There are two types of cells within the perichondrium. On the outer part of the perichondrium, you have their fibroblasts. What's the purpose of having fibroblasts in the perichondrium? Remember, the perichondrium is a dense, irregular connective tissue. It must have abundant collagen fibers. And what will produce these collagen fibers are the fibroblasts. Found on the inner area of the perichondrium are progenitor cells. And these progenitor cells are the ones that will give rise to the future chondrocytes, the cells of the cartilage. Please take note that the chondrocytes function to produce the extracellular matrix of the cartilage, which is composed of what? Fiber and ground substance. So in this picture of the cartilage, you have here chondrocytes occupying their own respective lacuna. And then you have here one perichondrium and you have here the other perichondrium. Please appreciate the presence of abundant collagen fibers. The perichondrium contains fibroblasts that will produce the large numbers of collagen fibers within the perichondrium. That's why it's a dense, irregular connective tissue. And at the same time, the perichondrium contains progenitor cells which can give rise to the future chondrocytes. So, that divides now the perichondrium into two separate layers. The layer with collagen fibers and fibroblasts, we call that as the fibrous layer. That's the outermost layer of the perichondrium. The layer of the perichondrium that is near the cartilage is called the chondrogenic layer. From the name of the layer, it is supposed to function to give rise to the future chondrocytes. We have here one perichondrium. Take a look at the outer fibrous layer. So the cells that you can find in there are fibroblasts. They are the ones depositing the collagen fiber in the dense irregular connective tissue of the perichondrium. And then you have here also the inner cellular layer, or also known as the chondrogenic layer, the layer that contains the progenitor cells which can give rise to the future chondrocytes. There are three types of cartilages, and we will first start with the most abundant one, and that's the hyaline cartilage. That's why it's stated in the PowerPoint that it is the most common type of cartilage in the human body. One of the importance of the hyaline cartilage is that it functions to provide template for bone formation. That's why in embryos, this hyaline cartilage serves as temporary skeleton which will be eventually replaced by bones. Please take note in the picture that the hyaline cartilage is provided with perichondrium on both sides. We will now be discussing the unique characteristics of hyaline cartilage that will help us differentiate it from the other two types of cartilage. Let's start from the area where we can find the perichondrium. Do you know at the periphery, the young chondrocytes or some of the chondroblasts appear to be elliptical in shape, just like the cell pointed by the black arrow. So the cells of the hyaline cartilage are elliptical, flat when they are found near the perichondrium. The elliptical chondrocytes near the perichondrium will eventually migrate towards the center of the hyaline cartilage, and as they are migrating, they will gain size and they will now become somehow spherical in shape. But the thing is, as they go towards the center of the hyaline cartilage, one chondrocyte will multiply and produce a group of 8 to 10 chondrocytes. Please take note that these 8 to 10 chondrocytes came from one chondrocyte, and we will refer to them as isogenous cell groups or isogenous aggregates, the ones that you can see in the PowerPoint slide. Again, at the periphery, they are appearing to be elliptical and they occur as single chondrocytes. And as they move towards the center, they will become bigger, they will multiply in number, and they will be grouped and called as isogenous cell groups or isogenous aggregates. So just like what I've told you, farther in, the chondrocytes will become round and they will multiply and produce several chondrocytes, and they will form isogenous aggregates which are composed of 8 to 10 chondrocytes. So shown in the picture are examples of isogenous aggregates or isogenous cell groups. Let's have a review. Near the perichondrium, the chondrocytes of the hyaline cartilage are elliptical in shape. Farther in, these chondrocytes will become round in shape, and one chondrocyte will undergo mitosis and will produce 8 to 9 more chondrocytes, and they will now form isogenous cell groups or isogenous aggregates composed of 8 to 10 chondrocytes. This is how the hyaline cartilage will look like under scanner objective. Please appreciate the abundance of the isogenous aggregates or isogenous cell groups. The chondrocytes in the isogenous aggregates will function to synthesize the extracellular matrix, the fiber, and the ground substance. By the way, I forgot to mention that the type of fiber present in hyaline cartilage is collagen type 2. Please take note of this. Take note that as these chondrocytes within the isogenous aggregates will produce the extracellular matrix, they will actually move apart from each other, and later on, these chondrocytes will occupy their own respective lacuna. So I want you to take a look at this isogenous aggregate here. It's composed of several chondrocytes. They will all function to produce the extracellular matrix, and as they are forming the extracellular matrix, they will be pushing each other away, and eventually they will now occupy their own respective lacuna. Before I will proceed with discussing the other two types of cartilage, I have to mention how cartilage grow. And they grow by two means. We have the appositional and interstitial growth. Appositional growth is the growth on the surface of the cartilage. And when you say surface of the cartilage, we're referring to the perichondrium. Take note, perichondrium contains progenitor cells, and these progenitor cells can become the chondroblasts. These chondroblasts will eventually mature to form the elliptical chondrocytes that are found near the perichondrium. And as these elliptical chondrocytes will migrate towards the center of the hyaline cartilage, these chondrocytes will start producing extracellular matrix. And this extracellular matrix will be deposited beneath the perichondrium. So if you have extracellular matrix being deposited underneath the perichondrium, it will cause the cartilage to expand. That's why appositional growth would result to the increase in the width of the cartilage. Cartilage can also grow by means of interstitial growth. And when you say interstitial growth, the growth occurs within the cartilage. Please remember, the chondrocytes will divide through mitosis, will produce the isogenous aggregates or isogenous cell groups. And the members of the isogenous aggregates will deposit extracellular matrix. And if you can recall, that the chondrocytes will start moving from each other because the extracellular matrix will push these chondrocytes away from each other. So take a look at this one isogenous aggregate. If the cells within the isogenous aggregates will deposit extracellular matrix, they will have extracellular matrix between them, causing them to move apart from each other. And when, take a look at the cells, if they will move apart from each other, they will cause the cartilage to increase in terms of its length. And that is the result in interstitial growth. Please remember, appositional growth will increase the width of the cartilage. Interstitial growth will increase the length of the cartilage. Unlike with the other two cartilages, hyaline cartilage can undergo calcification upon aging. And the problem is this calcification is associated with degenerative changes in the chondrocytes. So the chondrocytes cannot anymore produce the expected amount and quality of extracellular matrix. And what will happen is the hyaline cartilage will now be prone to being damaged. That's why this calcification is taught by some scientists na this is the reason behind what we call osteoarthritis. In osteoarthritis, there is joint pain not because of deposition of uric acid crystals in there, but because of the destruction of the hyaline cartilage. And what will happen now is, with the absence of the hyaline cartilage or the articular cartilage, the bone now will be crushing against each other, and that will now cause pain and discomfort. The next type of cartilage is elastic cartilage. This has almost the same descriptions as that of hyaline cartilage. It's just that in this type of cartilage, aside from collagen type 2 fibers, this one has elastic fibers. That's why elastic cartilage is more flexible than hyaline cartilage. Same as the hyaline cartilage, this type of cartilage also has perichondrium as shown in the picture. If hyaline and elastic cartilages have perichondrium, what would be our basis in identifying which is which? So take a look at the pictures of hyaline cartilage and elastic cartilage on the screen. Letter A is hyaline cartilage, letter B is elastic cartilage, both of which have perichondrium. These are the things that you should check in order for you to identify the type of cartilage you're looking at given that it has a perichondrium. Number 1, the presence of abundant isogenous aggregates, which is true to hyaline cartilage. And you see less of these isogenous aggregates in elastic cartilage. And aside from that, the chondrocytes of elastic cartilage appear to be bigger than the chondrocytes of hyaline cartilage. Okay, so what are the differences? Number 1, number of isogenous aggregates. Number 2, the size of the chondrocytes. So let's try to identify this cartilage. It has perichondrium on both sides. And then take a look at the cartilage tissue itself. The chondrocytes appear to be big and you see less of isogenous aggregates. So therefore, this is an elastic cartilage. Let's check this one. It has perichondrium on both sides. And then looking at the cartilage, you can see that the chondrocytes appear to be big and you see less of isogenous aggregates. So therefore, this is again another elastic cartilage. Let's have this one. It has perichondrium on both sides. It has abundant isogenous aggregates and the chondrocytes appear to be small. So this is most likely the hyaline cartilage. Elastic cartilage can be found in the following: elastic cartilage, air, epiglottis, eustachian tube. So I'm intentionally pronouncing the words that way in order for you to easily memorize where can we find elastic cartilage. Elastic cartilage can be found in the external ear or auricle. The auricle has two skin folds. This is one of the skin folds of the auricle and it is lined by stratified squamous keratinized epithelium. And this is the other skin fold, lined by the same epithelium. Between the two skin folds, you have there the cartilage. Take a look at the cartilage pointed by the red arrow. It's very obvious that it has perichondrium on both sides. And take a look at the chondrocytes. They appear to be big and you see less of isogenous aggregates. And these are characteristics of elastic cartilage. That's the very reason why our auricles are very flexible. We can actually fold them. It's because our auricles have elastic cartilages. Elastic cartilage can also be found in epiglottis, which closes the airway during swallowing. Elastic cartilage can be found in the eustachian tube. It is a tube that links the middle ear to our oropharynx. Normally, the pressure within the middle ear and the atmospheric pressure is equal. If you're riding a plane and the plane is currently ascending, there would be a subsequent drop in the atmospheric pressure. And what will happen now is the pressure within the middle ear will be greater than that of the atmospheric pressure. And that can cause pain and discomfort. Do you know what will be the response of the body? The body will use the eustachian tube. The eustachian tube will open up and allow the air within the middle ear to escape, causing now the drop in the pressure within the middle ear. Because of the eustachian tube, the pressure now between the middle ear and atmospheric pressure will be equal. But as the plane descends, what will happen is the atmospheric pressure will increase. And the atmospheric pressure now will become greater than that of the middle ear. And that's the very reason why we experience buzzing, hissing, or ringing sound in our ear. That's why some of us would blow air while our noses are closed so that we can pump air into the eustachian tube, then into the middle ear to increase the pressure there. Or some of us might prefer to chew gum. The point of this discussion is the eustachian tube has elastic cartilage allowing it to be flexible and adjust the pressure in the middle ear. The last but not the least among the three types of cartilage is the fibrocartilage. And this one is most often described by most literatures and references as an intermediate between a dense connective tissue and a hyaline cartilage, meaning you're just going to combine the dense regular connective tissue and the hyaline cartilage, then you will be able to come up with another type of cartilage, and that's fibrocartilage. So dense connective tissue meaning you should expect to find abundant collagen fibers. So take a look at the picture. Okay, you have their abundant collagen fibers. And since this time they are visible to the naked eye, they are not highly refractile, so that is another type of collagen. And that is collagen type 1. And collagen type 1 is the toughest and the strongest among the collagen fibers, right? So, the strongest type of cartilage is fibrocartilage. Then, it's an intermediate daw of dense connective tissue and hyaline cartilage. So, you're supposed to see chondrocytes. So, take a look at the picture again. Can you appreciate the presence of chondrocytes? Yes. So, this type of cartilage is an intermediate between dense connective tissue and hyaline cartilage. Since I can see a lot of fibers and I see chondrocytes of cartilage, fibers, cartilage, that's the reason why this is named fibrocartilage. The two areas in the body that contain high amounts of fibrocartilage are intervertebral disc and symphysis pubis, and I will be describing them later on. Another unique characteristic of this type of cartilage is that it doesn't have a boundary, meaning it doesn't have a perichondrium. In fibrocartilages, chondrocytes appear singly or in aligned isogenous aggregates. Take a look at the chondrocytes in the picture. They are really arranged in a single file. Take note, within the area where you can find the chondrocytes, you have their collagen type 2. But these isogenous aggregates of chondrocytes are separated from each other by those visible type 1 collagen fibers. So let's have a review. Hyaline cartilage has type 2 collagen fibers. Elastic cartilage has type 2 collagen fibers plus elastic fibers. In fibrocartilage, you have little amount of collagen type 2, especially on the areas where you can find the chondrocytes, and abundant type 1 collagen fibers. Again, fibrocartilage has collagen type 1 fibers, while you have collagen type 2 in hyaline and collagen type 2 and elastic fibers in elastic cartilage. In fibrocartilage, you get to see the collagen type 1 fibers, and embedded within them are the chondrocytes. Fibrocartilage is present in intervertebral disc. That's the cartilage that we can find between two vertebral bones. These bones would crush against each other even if the person is just sitting down. So to prevent their destruction, there must be a cartilage present between them, and that cartilage should be strong. So that's why intervertebral disc should contain fibrocartilage. Another example of fibrocartilage in the body is the symphysis pubis, the cartilage that we can find between two pubic bones. These bones would articulate against each other if the person would stand up, walk, run, and even if the person will just sit down. So to prevent the destruction of the bones as they articulate with each other, there must be a cartilage between them. And that cartilage must again be strong. So symphysis pubis must be a type of what? Fibrocartilage. I actually made it easy for you guys to memorize the examples of the cartilages. I told you that elastic cartilage is found in ear, epiglottis, eustachian tube. I also told you that intervertebral disc and symphysis pubis are examples of fibrocartilage. So whatever cartilage I did not mention as examples of those two cartilages will automatically be classified as hyaline cartilage. So let's have this quiz. Identify the types of cartilage present in the following. Number 1, trachea. I did not mention trachea in elastic cartilage. I also did not mention it in fibrocartilage automatic. The trachea has what? Hyaline cartilage. So the C-shaped cartilage on the wall of the trachea is hyaline type. Let's have another one. Nasal cartilage. Yeah, this is also another example of hyaline cartilage. The epiphyseal plate. This is hyaline cartilage. And this epiphyseal plate allows the bone to grow in length because the bone will replace this type of cartilage so that the bone can expand. So since epiphyseal plate is a hyaline cartilage, the cartilage that can provide a template for bone formation is really hyaline. Let's have another one. Ear, the auricle. Yeah, this is elastic cartilage. How about epiglottis? Elastic cartilage. How about symphysis pubis? Fibrocartilage. How about the cartilages that we can find in our ribs, no? The ones that connect them to the sternum? They are hyaline type. How about the articular cartilages present on the joints? The one that will allow the bones to glide with each other. They are what? Hyaline type. Now, there's one thing I want you to take note. All the hyaline cartilages have perichondrium except for the hyaline cartilage in the joints, the articular cartilages. They do not have perichondrium. Another example of a hyaline cartilage that doesn't have perichondrium is the epiphyseal plate. Because epiphyseal plate is supposed to be replaced by bone so that the bone can increase in length. If that epiphyseal plate is provided with perichondrium, and perichondrium is a tough covering, right? So the bone will not be able to replace the epiphyseal plate. So the bone will not be able to increase in length. So you have to devoid the epiphyseal plate of perichondrium. So all hyaline cartilages are provided with perichondrium except for two. The cartilage in the joint, you call it as articular cartilage, and the epiphyseal plate. If the cartilage is damaged, how do you think the cartilage now will repair itself? Before I will discuss that, I want everybody to take note that cartilage is avascular. The chondrocytes of the cartilage are contained within the lacuna, so they are immobile. And these chondrocytes are known to have poor mitotic activity. So expect that the repair of cartilage would be a slow process. And what will facilitate the repair are the cells coming from the perichondrium, because you have their progenitor cells that can give rise to chondrocytes, which will produce the extracellular matrix of the cartilage. But if the damage is very extensive, the perichondrium will produce a scar rather than a new cartilage, because the outer fibrous layer will cause the fibroblasts to deposit now collagen fibers into the cartilage tissue, forming now the scar. And that ends my lecture on cartilage. Thank you very much for listening.